Thank you so much for joining us today for our event entitled Sanctions and Medical Education, the Case of Iran. I'm Nargis Bajogli, an assistant professor of Middle East Studies at SAIS Johns Hopkins University. Today's event is a part of our Rethinking Iran initiative, which has launched 13 reports from an array of international scholars looking at the impact of sanctions on Iran. These reports stem from our project at SAIS entitled Iran Under Sanctions, which has been the first comprehensive look at US sanctions on Iran, studying the impact of sanctions on Iran's economy, energy, environment, social, political, and cultural sectors. For today's event, we're featuring the work of two scholars and experts who have written on the impact of sanctions on medical education and infrastructure more broadly in Iran, Professor Orkideh Behrouzan and Tara Sepehri Far. They'll be in conversation with Professor Omar Dewachi. US sanctions have impacted not only access to medicine, but also healthcare education in Iran, resulting in infrastructural, cultural, and pedagogical changes. Physician and anthropologist Orkideh Behrouzan and Human Rights Watch researcher Tara Sepehri Far have written a report for the Iran Under Sanctions project on the impact of sanctions on medical education and these broader infrastructural issues in Iran. Before I introduce our speakers for today, I'd like to invite all of you in the audience to ask your questions throughout the event in our chat box on YouTube, and our team will pose those questions to our speakers during the latter half of the event during the audience Q&A section. Our speakers for today's event include Orkideh Behrouzan, who's a physician, medical anthropologist, anthropologist of science and technology, and the author of the book Prozac Diaries, Psychiatry and Generational Memory in Iran, which was published by Stanford University Press in 2016. She's the founder of the Beyond Trauma Initiative and a bilingual author and poet in Persian and English. She's a professor at the School of Oriental and African Studies at the University of London. Tara Sepehri Far is a researcher in the Middle East and North Africa division of Human Rights Watch, where she investigates human rights abuses in Iran and Kuwait. Prior to joining Human Rights Watch, she was the deputy director of the Human Rights in Iran unit at the City University of New York, where she worked on a project supporting the mandate of the UN Special Rapporteur on the situation of human rights in Iran. Tara graduated from the Sharif University of Technology in Tehran and holds an MA and LLM degrees in international law from the Fletcher School of Law and Diplomacy at Tufts University. Omar Dewachi, who will be moderating today's event, is trained in medicine, public health, and anthropology, and his work examines the social, medical, and environmental impacts of decades of war and violence in Iraq and the broader Middle East. His award-winning book, Ungovernable Life, Mandatory Medicine and Statecraft in Iraq, which won the New Millennium Book Prize in 2019, documents the untold history of the rise and fall of state medicine in Iraq, the unmaking of infrastructure, and the exodus of the country's expert doctors under decades of US-led wars, sanctions, and occupation. He's currently working on a book manuscript entitled When Wounds Travel, Ecologies of War East of the Mediterranean, which chronicles close to 10 years of ethnographic research and public health practice in the Middle East. Working towards an anthropology of wounds and wounding, the study explores the different registers of the wound as its entanglements in the thickness of social relations of vulnerability and care, and the broader political and environmental ecologies of war. More specifically, it documents the widespread of conflict-related injuries, multi-drug resistant bacteria, and the reconfigurations of healthcare and humanitarian geographies in Iraq, Syria, and Lebanon under decades of protracted conflicts. Dewachi is the author of numerous publications that have appeared in medical, anthropological, and global health journals, including The Lancet. And just more broadly, these are three people that I'm constantly learning from, and I hope you all will enjoy this conversation over the next hour as much as I intend to. So without further ado, I hand over the floor, or the mic, so to speak, to Omar Dewachi.
Thank you very much for having me as part of this really critical and important conversation on sanctions in Iran, and specifically the effect on healthcare and medical education. And I think this is going to be a very important kind of broader conversation on sanctions in general. That is what I'm hoping to to have, and kind of to bring in our audience into some of the experiences that are documented brilliantly by our two scholars who wrote this, I think, very incredible report, which I think is a beginning of a broader project looking at the both the direct and the indirect impacts of sanctions in Iran. So one of the things that I have found in my own work, which really keeps returning back to the question of the periods of the sanction with Iraq, which what we call in Iraq al-Hisar, is to think about the present unmaking of the Iraqi state. Iraq has probably been under one of the most comprehensive economic sanction systems that almost like 12, 13 years during the 1990s. The impact of these sanctions have been really far-reaching and irreversible. So I find this conversation to be very useful and productive, especially in comparing to also neighboring countries, Iraq and Iran, and their experiences with the kind of the different modes of sanctions and different kind of politics of sanctions. And in reaction to that, how these sanctions have been impacting the healthcare system, healthcare infrastructure, and specifically looking at, I think what the authors really highlight is looking at the impact on medical education, something that often doesn't come to the immediacy of thinking about the kind of the broader impacts of the sanctions. So I'd like to, I guess, since this is going to be more of a conversation, I'll be posing some questions and hoping that, these questions will just start some kind of a discussion on some of these issues. And I'm hoping that this could be partly not very, very formal, but we can constantly go back and forth and thinking about the paper, but also thinking about the broader implications of this work on understanding the sanctions in general and their long-term effects and long-term implications. So my first question, first of all, thank you so much for having me, and I'm very honored and pleased to be part of this conversation again. My first question is to the authors of the report is, can you give us a little bit of an overview of the research that you've conducted? What really driven you to focus on medical education specifically, and how did you conduct this research? And I guess the kind of the third part of this question is if you can actually give us a little bit of an overview of the main findings of this report. So I turn the mic to you both.
Maybe I can start and then have Orkideh explain more about the research. The issue started with actually Orkideh and I discussing what we wanted to write about. We knew we wanted to write about the impact of sanction on healthcare in general, but we didn't have a very specific topic in mind. At Human Rights Watch, I have looked at the impact of sanctions on access to healthcare. And the way I looked at it is very much the causal relationship of finding the exact policy, examining the humanitarian exemption that exists in the text of US sanctions, seeing if they're effective in allowing medicine or medical equipment into Iran or not. But this is not the question we're looking at. As we were discussing it, we realized that we were interested in understanding the experience of people living under sanction, as opposed to a legal analysis of the sanction or the narrowly focused causal dichotomy of our sanctions having a negative impact or not. And in looking at that question, we realized doctors are particularly located in a very particular place in the society. They are the ones as part of the society impacted by the general implication of sanctions, and their livelihood, their education, their perception, and at the same time, they are the ones performing a very critical role in terms of access to healthcare. In that sense, if we consider patients at the end point of healthcare, well, they receive the accumulated impact. Healthcare professionals, doctors, are in a different perspective. They are impacted, and they are causing impact as well. And that kind of draw us into looking at the question of impact on medical education itself, a question that was less explored. And I'll stop here, letting Orkideh take it from there. But I thought it was really interesting, the conversation Orkideh and I had in order to come up with the topic alone, taught us a lot about the question we were going to explore.
Thank you, Tara. Thank you, Nargis and Sais, for having us for this wonderful event and making this project possible, and for Omar for engaging with our preliminary report. I just follow up on what Tara said, that when we were thinking about the topic, one of the things that's at least personally very important for me was to look at something also that wasn't about immediate crisis, but also about long-term effects. And the interest in the long term and the afterlife is a place where different areas of my work converge, and an interest in pedagogy in general. And as Tara said, both medical doctors and also education are areas where some of the most palpable issues of day-to-day life in relation to sanctions and other forms of other restrictions are experienced. And this emphasis on shortages and access to medication has all, this was also a response to that. On the other hand, we also had some idea of how things, as the anthropologists like to say, are complicated and complex, and not, this idea of sanctions being responsible for all ills, and sanctions being scapegoated for a lot of issues that we all know are extremely complex and rooted in domestic and international conditions. So we wanted to also shed some light on that. And in terms of the findings, so we basically interviewed colleagues, medical educators, as well as medical trainees in Iran. And of course, some of this was also put in a historical perspective, because medical education turns out has changed a lot since the 90s, when I was a medical student in Iran. And all of that reform that medical education has gone through, in part, can be also seen as a response to both sanctions and international developments in medical education. And so we were interested in delving into that. And some of the themes that emerged in conversations included a sense of isolation from the international community, also the international knowledge community and medical community, restrictions on travel, restrictions on access to material, online material, journals, conferences, and resources that are increasingly becoming, in fact, software-based and online. But then there were tricky moments where people were like, well, actually, we don't know whether we can't have access to X, this platform or that resource, because of sanctions or because of censorship, because those sites are blocked, for example. So that gives you an idea of the complexity and lack of consensus over causality, really. People also reflected on issues of brain drain, which is directly related to medical education, and I can talk about that a little bit later. And of course, the demise of the middle class in general, which medical doctors are presumably part of, is part and parcel of this conversation. As Tara said, doctors are experiencing sanctions as citizens, as well as, as medical doctors, medical educators, or trainees. And we realize that a lot of this comes out in moments of decision-making, whether it is clinical decision-making, decision-making in relation to research, and also personal decisions, such as the one I mentioned, whether to stay in Iran or not, or how to make ends meet, etc., etc. And the developmental stage of life where residents, medical trainees are in is also important, because these are people who are also embarking on careers that increasingly seem to have not such a bright, prospect, so to speak. So I'll just stop there, and we can come back to some of these themes.
Thank you so much. This was really very, very helpful. So I'd like to come back to some of the points and maybe kind of dissect some of the three key areas that you guys highlight in the report. The impact on training, you've written, has one of these comes at these three axes. And I really appreciate Tara's comment, the kind of this idea of the dual role of the doctor, both as a citizen experiencing the sanctions, but also as a kind of a figure located to deal with the kind of the immediate impact of the sanctions, responding almost to this what a scholar Joy Gordon had called an invisible war. I mean, when one could see sanctions as a form of an invisible war against these different societies, what we've seen in Cuba, what we've seen in Iraq, what we've seen in Iran. So I think the role of the doctor is very much is an interesting one, because it represents that node of understanding how society is dealing with this, specifically, as you said, middle class, and then of course, how is that also reflecting in the forms of care, forms of response to these kind of material, physical, and the symbolic impacts of the sanctions. So the 3 points that you highlight are: one is access to education material, which you kind of talked about a little bit, Orkideh, just now. Access to global economies of knowledge, international mobility and exchange. And then the third point is the modes of socialization and professionalization, what you identify as ways of being and becoming a doctor. So I wonder if you can kind of take us or lead us through each of these points and highlight what you've seen as a kind of critical finding in this work, and how that could help us in thinking about different ways of understanding this impact on education.
Tarajan, do you want to take the first one? And then I can talk about the professionalization, socialization.
Sure, I'm happy to do that. So, and what was really interesting is that these all themes kind of came up naturally and concurrently as we were speaking, while the discourse of resistance, isolation, hopelessness, modes of improvising, learning by doing were present in all different themes that I hope Orkideh will explain. But maybe the clinical decision-making is the one that's easiest to see. It's the most visible one. It's the one that most easily identifiable in terms of what would be categorized, for instance, as direct impact. I spoke mostly to people who were in the educational stages of their training, and they all very much emphasize this experience of learning by doing, and how having access to certain technology devices, medical technique will allow them to learn how to work with this. And if they lose that opportunity, even if later on they come across those cases or have access to those technologies, then they don't know how to use it. So this sense of the lack of access will impact our education was very present in terms of, as I said, different scanning techniques. And that one is more visible when you're talking about different specialization, because as Orkideh briefly explained, the general education has is not that much dependent at technology. But then there was also the issue of different softwares and techniques, and what people do to still use their technologies, and at what point they give up using them, and what they attribute as causality. For instance, for a medical educator, knowing the cause of the absence of a device at a hospital, is it because the government hasn't tried its best to bring it? Is it because sanctions are preventing it? They were all present in that conversation, but the end result was that if I'm not able to learn it now, I'm not going to be able to use it. And then at the same time, there were stories of like how professors and doctors try to use alternative techniques to still cover that aspect when they can, in the hope that they would be able to use it. Is that sufficient? Unclear. And the application stuff, which I thought was very, very interesting, is that as Orkideh mentioned, even though there were clear answers from an objective perspective, application X is blocked by US sanction, platform X is not providing access to Iranians simply because of the risk of sanctions. On the ground, people don't necessarily know if they need to turn on their VPN to access it, if they need to buy it, because VPN works both for state censorship and for US sanctions. So on that end, there's still the causality. But then what was really interesting to me is that a doctor, an OBGYN doctor, explained that she had several apps on her phone that helped her expedited her diagnosis. But at some point, paying for subscription of these apps was simply not worth it. The general economic deterioration of economic condition, the exchange rate, that was not something visible. At some point, she came to the conclusion that even though she had access to all these ways to circumvent the sanctions, it wasn't worth it anymore to pay X amount of money to still use them. And then she's going to try to improvise. So even though we categorize these different three aspects and access of impact, what was really interesting is that these different layers of modes of being were present in every three aspects. And I think Orkideh can explain more about the research and the sense of one's profession, and I'm happy to complement whatever she said.
Thank you, Tarajan. Yeah, I think as Tara mentioned, the clinical aspects are the more visible ones. And then if you want to focus on the invisibles, so to speak, we were paying extra attention to perceptions on the ground, to rumor, to hearsay, to interpretations that people have. I mean, sometimes a software might actually be unavailable for other reasons, and still people feel that it's because of censorship or because of sanctions. So those feelings are important because over time, the chronicity of this sense of frustration, and people would say, how many times do I try something before I give up? How many times do I try to, or the same goes with mobility. I mean, people, the restrictions on travel are in part because of, political issues, in part because of the sanctions, but also in part because of decisions inside the country. So people bring all of that up, and it's as if there is such frustration waiting to come to surface when you ask a simple question like, can you go to conferences or not? And I think this is important because this inner turmoil and a sense of being cut off has really long-term consequences. And it results in the corrosion of hope over time. And that has an impact on education directly, because so educators would tell you, for example, our top students used to be, when I was in it, they would tell me that when I was in medical school, our top students, when they got to the internship stage, they wanted to do everything on the ward. They wanted to be involved. They would compete to be, to stand in on a surgery or something. Now, most of our top students by that stage are thinking about migration. So at that point, they're investing in a master's degree to strengthen their CV, and they're disengaged in the world. And as an educator, this really affects me because, you know, so that's I think extremely important, because it's the inner work that I think cannot be traced in reports that's solely focused on quantitative analysis or on policy reports, and as Tara mentioned in the beginning, on the effects of exemptions, etc., etc. And there's a lot of workarounds as well, both in the clinical setting and in research. Eventually, people do submit articles to international journals. People do use the VPN. People do go to conferences. But the effort it takes and the number of times it doesn't work is what's not spoken about. And that's really important. And part of what I'm really interested in terms of medicine in general and pedagogy in general is this idea of learning by doing, which is part of the medical ethos, at least in training in Iran. And this doing involves a lot of workarounds, involves a lot of know-how in terms of who to go to get access to something that's not accessible, but at the same time is linked to that sort of sense of demoralization and how much enthusiasm you see on the words. And if you focus on the clinical part of the training as opposed to the theoretical part in the beginning, that has a very palpable impact when you talk to doctors.
Thank you so much. I mean, I hear very kind of familiar stories here with some of the experiences that I had also as a physician working in the sanctions in the 1990s in Baghdad, in one of Iraq's biggest hospitals. A lot of the doctors were becoming disenchanted with the kind of the practice of medicine as a kind of a humanitarian work, you know, because, you know, in the moment of sanctions, when the stress hits society, the doctor's role becomes very highlighted, as you have kind of nicely put it. But then we see a different kind of reaction where doctors are more concerned about their CVs, they're concerned more about getting the right experience to be able to leave and work in a different kind of system. So I think that is an important demoralizing factor that we see in these moments of sanctions. And I think it also raises very interesting points about how medical training is shaping doctors in general. I mean, is medicine as a kind of as a humanitarian kind of field is responding to the ailments of society, or is it a field of status and becoming a doctor and opening your clinic? And so I think there's a lot of interesting tensions that you highlight in the work that speaks to this ambivalence to what medicine means in the context of sanctions. So having said that, I'm also curious to ask about something you really kind of touch upon in the paper, which is what you call the politics of scarcity. There is a very interesting tension going on in the paper around people attributing some of these lacks and some of these scarcities to the sanctions, or attributing them, as you, Orkideh, as you said, to the censorship. And I think this brings up a very important point, which is the relationship between medicine and the state. So one of the things that, at least in the politics of scarcity, that I've kind of been involved in, or I've written a little bit about, had to do a lot with how the Iraqi state performed its inability to respond to the collapsing healthcare. So one of the things people who maybe lived that period remember, in the late 1990s and 97, the Iraqi state organized these parades of dead children. So where they put these children the top of taxi cabs and paraded them in the street as a kind of as a result, as kind of claiming that these are the results of the sanctions. And of course, as a doctor, we were seeing this. We were seeing the high numbers of deaths in Iraqi hospitals. But it seems like there is something a little bit also different at work. What the Iraqi government at that time did was to kind of perform this inability to govern, to show that it's unable to save lives in Iraq. And of course, this metabolized and refracted a lot in the everyday practice of doctors who are kind of scrambling to deal with the lack of medications and the collapse of hospital sanitation, the high rates of infections that were happening. I mean, during the sanctions in Iraq, the infant mortality and maternal like doubled during these 10 years. So I'm wondering, how do you see this connection, this tension that you kind of highlighted? And I know it's probably a very sensitive issue, but how do you conceptualize and comment on these tensions between the state, politics of scarcity, and how the state is maybe using or kind of posturing in relationship towards the sanctions, specifically in relationship to the medical and the healthcare sector?
I mean, I think you correctly pointed out the tension, and I think the tension is real and the tension exists. There is a tension because the tension exists in and is reflected even at the policy level. When we're talking about sanctions, we're talking about international measures, punitive measures that target the core of state national security, and it's being understood as such. So doing research on these issues is actually extremely difficult because it's very much correlated with the state national security and the way they decide to project that. In Iran, a phrase that has been promoted under sanction is resistance economy. And I would say, at least for the past 20 years, Iran has been in the resistance mood. It's being glorified, valued, promoted as a matter of state doctrine. That we are resisting this pressure because it's unjust. And people who buy into this doctrine are being rewarded for that. There's some real, as we point out, there's some real resistance that is being shaped as a result of the results of the scarcity by people, by doctors, by policymakers. A lot of the policymaking is a response to this reality that exists. But then at the same time, because it's a matter of national security, doing research on this issue is also complicated. With my Human Rights Watch hat, when I go to the Iranian government and ask for data to study the impact, I'm shut down because showing weakness is showing the effectiveness of sanction. At the time that the state hasn't decided, for instance, to negotiate with the international community over those sanctions, that can hurt them. But at the same time, again, there is a recognition that these are unjust. Therefore, there is support for saying they're unjust, but allowing researchers to independently study and form their own narrative on these issues is not happening. And I think this also points to what we've been discussing in terms of the complexity of the nature, that the internal reality of a repressive state, it cannot be separated from the sanctions. And again, I'm speaking with my policy hat here. I think it's the making and unmaking of sanctions consider these realities at the same time. They might not be formulated in the text, but they're part of the calculation and equation. But just to summarize, I think Iran is still in the formal state discourse is still resistance. In that sense, resistance can be rewarded, can be exaggerated, can be used to mask problems, but I think sanctions are also have been the scapegoat for incompetency. And you can see that as manifesting itself in the issue of a government response to COVID crisis, for instance, right now. And I stop here and let Orkideh explain.
Yeah, I'll just follow up on that I'm so glad you brought up the issue of the state, because I wanted to kind of come back to the example of the pandemic and how the sanctions have been used to justify some of the extremely explicit incompetence instances that, for example, late response, delays, etc., etc. A lot of people blame the response on the pandemic on, again, shortages, this issue of shortages, whereas, and for the pandemic, there is no medication, there is no drug, there is nothing that, it wasn't an issue of shortages, it was an issue of, delay in distributing information or correct policies. So this idea of, I wanted to just point out a few things. One is that this securitization of almost everything also, comes into this question of sanctions. The fact that we haven't been able to name our colleagues who we've interviewed in the acknowledgement of our piece is quite telling, because we're not sure if that this might cause them problem and trouble. And this is because speaking about sanctions at different points can be an issue, and sometimes it cannot be an issue depending on how you mobilize it. So in terms of that relationship with the state, I think that's extremely important to remember, that part of this politics of scarcity, as you mentioned, is also rooted in other crises. One is the crisis of legitimacy that's already ongoing, and issues like sanction just get superimposed on them. There is a very, very low level of public trust in policymaking. There is also a question of this of a crisis of expertise, because there is a general sense that we are now 4 decades after the revolution, therefore 4 decades after the Cultural Revolution. A lot of the experts, quote unquote, scientists, experts who knew what they were doing are pushed away from the realm of policy. And people are extremely aware of this. So people who are making policies are not people who should be making policy. These are perceptions that shape people's, and it takes me back to the sense of demoralization that you talked about, Omar. Society in general is at an impasse because of these underlying crises. And one of our, in a way, our key finding, one of our key findings was it's impossible to pinpoint which one of these issues is the result of the sanctions, or because then again, bear in mind that people immediately also remind you in interviews that why are we under sanctions? And then they take you back to the question of, well, it's depending on which ideological leaning they're coming from, but this mention is also important, that we are under sanctions for a reason. It's unjust, but at the same time doesn't justify what the regime is doing. So this kind of being caught between a rock and a hard place is a theme, running theme in a lot of these discussions. I think I just want to make a final point about this idea of it's kind of related to the work I'm doing now in relation to COVID, and sanctions come into it, because we're talking about something that can be called a landscape of internalized, a discourse of death and disintegration and debility. That's, the notion of death has become part of everyday life, disintegration, the fact that right now, for example, there with electricity shutdowns over the past week, in major cities. I don't want to go into the reasons for that, but the perception again of people is there is incompetence, there is also sanctions, there is also, and so it's not like science that we can do an experiment and put our finger on, a monocausal issue here.
Thank you. I think the point that you make that hits home very clearly is how this impact on education, on the formation of expertise, on the medical system has a much broader impact on society and the way society kind of even interprets and understand these kind of breakdowns. You know, I mean, this is something I've always been kind of interested in, is how breakdowns are lived, how breakdowns are experienced, and what do they kind of produce in terms of like more long-term effects. So one thing maybe I want to kind of bring up. So one of the ways to when comparing. When I was, let's say, doing my work on Iraq, the clear example for me was always Cuba, was always the how Cuba experienced the 1990s, what they call the El Periodo Especial, which was basically the special period of the 1990 sanctions, when the Soviet Union collapsed and Cuba kind of was left on its own, dealing with a lot of the economic scarcities and the impact of that. And I think kind of the work of Sean Bretherton on that period and the role on the kind of his book Revolutionary Medicine highlights some of these really interesting factors. So in one of the things that I found are to be contrasted, at least with the experience of Iraq, is that Iraq went through this massive destruction of infrastructure and prior to the sanctions. So not only that you're not able to kind of maintain a system, but you're not able even to reconstruct it after its collapse. So in that kind of spirit of comparison, I feel one of the things that the Cuban model of sanctions has shown, at least from the healthcare angle, is the regional role of Cuban doctors across different kind of landscapes. Their role in crisis. Some of these doctors are sent to crisis areas to respond. Their role in a much broader kind of idea of education across the South America and Latin America in general. Given Iran's regional role and its kind of long investment, as you said, in this politics of resistance from Lebanon to Iraq to Yemen to other parts of the region, has there been a kind of a regional role for doctors? Has there been a kind of the global as you articulate, the global connections have been severed, or at least more or less severed. What about, are there different avenues? Is this kind of pushing the medical doctors in Iran to think on a different scale, to think about it on a regional level, especially given the kind of the very deep and close connections with Iraq? There has been a lot of Iraqis who go to Iran for medical treatment, for example. So these are processes that have been ongoing. So I wonder if you can kind of touch a little bit on that, and if that kind of has any interesting, are there any interesting insights from thinking about Iran's medical system within a kind of a more regional perspective?
Yeah, I can say something about that. Well, the question of Cuba is actually really interesting, because in the early 1980s, the Iranian public health system was extremely inspired by Cuba. And a lot of the successful public health policies of the 1980s in Iran, including family planning and the eradication of polio, things like that, were very much inspired by that model. And it was very explicit also. Four decades later, something has changed. One is that there are intersecting crises that have intervened. The same can be said about war medicine, because during the 80s, as you know, like medicine in some areas was damaged and in some areas flourished, because there was this sense of sufficiency and not having to send patients abroad for treatment. So these are, the progresses that have been made, but then some of them are undone because infrastructure has worn out and hasn't been reproduced or replicated or repaired. And of course, the other crises that I mentioned are also there. But what has happened is something that's happened in the past 10 years is that we also now have international campuses on in Iran, and one of the key interventions was that medical school, the Tehran Medical School, Tehran University Medical School is now having an international campus and has, as you said, relied on regional allies. So students from Iraq, from Syria, from Kashmir, from India, and from the Gulf are coming to now. This part of this is income, and part of this is about diplomacy, but a huge part of it is about soft power, because Iran is now training medical doctors who will then go back and become part of the medical establishment. In fact, there is one of my interlocutors has told me that there is now a new campus being built in Abadan, specifically for Basra, for links with Basra. So there is a longer term vision in terms of regional supremacy, if you will. Now the question of how the nitty-gritty of that works, what the quality of education is, because the same professors who are teaching there also tell me, well, the criteria for accepting these students is very different. They're very skeptical of the quality, but it doesn't matter, because the point is not quality medical education. The point is, regional links and marks to be made. So that's an extremely important sort of side effect, byproduct of this situation.
Okay, well, we'll go into audience Q&A for a little bit. So one of the audience members, who is also a trained physician in Iran, she states, is wondering, or is posing the question that from her perspective, the state has not invested in the medical field over the past decades, and that what doctors or the medical field in Iran are experiencing is that kind of lack of investment, whereas the priorities of the state have been elsewhere. And so she was wondering about that aspect of it from the both of you.
Tara, should I go, or do you want to? Well, that's more of a comment than a question. I think there is truth in that. As I said, infrastructure is a huge problem, and we all know that that's one of the unfortunate legacies of sanctions, is that so one of the points about infrastructure and death right now, I mean, all of these things that we're hearing about, people dying, for example, COVID patients are dying in some countries, including Iran, Nepal, India, because of shortages in oxygen supply, or suddenly this hospital's electricity being shut down, not because of the virus. So the patient is in an ICU, is getting treatment, but then suddenly the infrastructure collapses on you. So that's something that's been commented on, that's been known, and it's in a way it's common knowledge also in Iran. The investment, I think that the question of investment is important because it's not driven always by scientific standards or aspirations. Sometimes it's driven by geopolitical interest. That being said, Iran, the Iranian establishment has extremely high ambitions technoscientifically, and has always had high ambitions technoscientifically. So this sense of self-sufficiency in the region in terms of technosciences, and we see that in stem cell research, we see that in Iran was one of the first places where IVF became possible, that kind of thing in the region and among the Muslim nations. That's a rhetoric that's very important to the identity of the Islamic Republic. And so you see both sides of this. Maybe in some ways it could be said that a lot of these efforts are uncoordinated or seem uncoordinated because something is happening in one packet and in another packet is being undone. But these are competing interests, competing agendas and competing interests in both directions.
Tara, did you want to add to that, or should I go to the next question?
No, I think Orkideh put it very well. And what I would add to it is that I think policymaking in Iran has been basically categorized by what is commonly referred to as the current critical moment. Like there's this sense of urgency, this sense of instability, this sense of living in the moment and having to do policy making. And that doesn't necessarily, and I think what Orkideh correctly pointed out is what seems to be competing interests of different groups, the medical community, the medical educator community, the state security apparatus, understanding of the role of medical education in the society and the broader politics of it. So I think resources and investment is definitely a very relevant factor to be taken into account, but I think it will come back to the complexity and the impossibility of pinpointing the monocausal issue. And it's very interesting that even when people bring up the let's say sanction or resources as the first element, within 5 to 10 minutes of the conversation, that the next one comes up. So it's what you choose to go with depending on how your life is being impacted is also important, I think.
Actually, I'd like to add something here. That was an excellent point. This short-termism that Tara talks about is really key here, because I'd like to sort of historicize this issue of competing agendas, because competing agendas, if 15 years ago, it was possible for me to say, well, there are competing agendas, there are fractions within the establishment that are techno-scientifically minded or technocrats, and that is changing and changing and changing, because at this point, the level of expertise and excellence has decreased, and the level of cronyism and corruption has increased, and that has a long-term effect. So competing agendas are not the same as what they were 15 years ago or 10 years ago, and it's important to remember that these competing agendas also change. And currently, it seems that one set of agendas are way more powerful than the other set, unfortunately.
Thank you both for that. So there are a couple of folks who are asking, and I'm just going to try to summarize their questions. They're wondering if your research identified any solutions that could be applied, either internally or involving the international community. So in essence, what are there sort of solutions, policy-oriented most specifically, around the issues that you all are identifying in your research and in your paper?
I can go ahead. I think we're ending this paper by posing questions, and there's a reason for that. And our intention, I think the most important takeaway is to consider these different aspects in talking about sanctions. I come from the policy community, so I'm very much used to wanting to have a quick fix. But I think our research is an invitation to understanding the complex impact that these web of policy measures that are being imposed far away from Iran are having on the everyday life of Iranians. So as much as I would like to give you 1, 2, 3 in terms of this is how to fix the system, I think the first point is to understand the complex nature of it. And naturally, if I want to take it one step further, is that when imposing those policies and when considering the impact, appreciate the complexity of this issue. Under the previous administration in the US, the question became solely the blame game by the Iranian government and the US government in terms of who is at fault here. And the problem was completely diminished to proving the other side wrong. And that's exactly what can dehumanize and the experience of Iranians who are living, again, as we pointed out, with this different integrated multi-factor setting. And I think that's a problem. Understanding the complicated nature of it will also allow us to understand the harm better, I think.
I mean, as a non-policy person, I unfortunately I'm not able to offer any fast solutions, but I think that the idea of when we're discussing sanctions or wars or invasions or things like that, let's think about the complexity, but also consequences, and the consequences are happening to people who have names and families and faces, and they're real. And so it's a very obvious point, but it seems that it needs to be reiterated. And I think the other aspect of it is to be aware that you are already dealing with in some sense, an immunocompromised body, and a situation where already things are in a state of disarray. And so imposing sanctions is usually, as we can see here, only affecting ordinary citizens, including doctors, but affecting doctors also affects ordinary citizens in a loopy way, but not the people that the sanctions are aiming or claiming to target. So that wasn't a solution. Sorry.
No, it's great. We have another question from an audience member who wants to know, has the US government taken any action to ameliorate the situation, I think, around medicine in Iran, especially with regards to COVID-19?
I'm assuming that question is for me. The reality is that the sanction regime has not changed between the previous administration and current administration. They're still in place. The US did take certain actions in the aftermath of COVID crisis to clarify the existence of humanitarian exemptions, but certain challenges that existed pre-COVID have persisted. For instance, in questions related to Iran's access to funding sources abroad for purchasing vaccine, and the use of COVAX mechanism, a WHO established initiative for accessing vaccines. So that's the short answer. But again, I want to bring back the conversation as an invitation to understanding the complexity of the impact, the long and medium term impact, and the fact that with my policy hat, I advocate for quick fixes. But I think at some point we need to pause and acknowledge that the situation is more complex. And speaking solely as a matter of policy impact, we're pretending that this broader context doesn't exist. And I actually find it hard to believe that the people who are very competent in policy crafting are not aware of or they take a moment, they cannot appreciate the complexity of the situation.
So I'm going to take my prerogative as the host of the meeting to ask a last question. And I want to ask it of the three of you. So Omar, in your book, you kind of invite us and challenge us to think of new conceptual and methodological tools to study the Middle East under all of these decades of sanctions, whether by the UN or the United States or different sort of entities. And especially at the further that we go along, the United States is really using sanctions as one of its primary foreign policy tools, as a tool of statecraft, increasingly across the Middle East, but also across the world. And taking advantage of the fact that you guys are looking at different locales within the Middle East and can talk about this comparatively, if we look now at not only Iran, but Syria, Lebanon, certain aspects of Yemen, we're looking at situations, Palestine and Gaza, we're looking at situations of embargoes, situations of blockade, situations of heavy sanctions, situations of actual armed conflict and wars. So how, as social scientists and researchers, how do we take your invitation seriously, Omar, and moving forward? And how are we thinking, Orkideh and Tara, in the types of research that we're doing now about methodologically and conceptually taking all of these different forms of conflicts. And as you were saying, Tara, not looking for quick solutions, but really understanding the complexity of everything that folks are experiencing on the ground, both to understand what's going on in all of these dynamics, but also, and Omar, this was something I really hang on to a lot from your book, is the discourses of state failure that are almost endemic to sanctions regimes. So sanctions regimes both induce a form of state failure, but also create discourses of state failure that kind of are like a feedback loop, right? So whether state failure is actually happening in certain sectors or not, it doesn't actually matter, because after a while, it's the discourse of it that takes over. So that was a very long sort of question, and you guys can take it in any direction, but I would just love to hear you all as you riff on that.
I'll go first, so I can leave the last few words to to Orkideh and Tara. So thanks, Nargis, for this question. So one of the things that I've been trying to really examine how these interventions first kind of create, as you said, they create this ecology of state failure. So not to only think about these failures as like, oh, we can't just do this and we cannot do that, but actually looking at it as a biosocial process. Both the biological milieu and the environmental milieu in many of these countries under these problems have been also changing. So we're not just dealing with lack of material, but we're also dealing with transformations that are happening in the environment, in hospitals and the clinics. So one of the things that I've kind of tried to have been emphasizing is for example, the impact of these long-term interventions like military bombardment and sanctions on the rise of multi-drug resistance bacteria, and how that eventually creates more stress on the system. So for me, some of the key points is looking at what I have called the undoing of the body politic. What we've been seeing across the region, as social scientists are obsessed with looking at questions of biopolitics, like governing this, governing that, but what about the ungoverning? What about the ungovernability of things? How do these things manifest in these moments of the undoing of the state? And I think that is something we've been seeing very clearly in the Iraq case, in the Syria case, in Lebanon, in many countries, and of course in Gaza also. The whole idea of bombing or imposing sanctions is a form of challenging or undoing of the body politic. That's the kind of the idea. So that's one point that I think is very important to highlight, that what we are seeing is not just punishing of regimes, but we are looking at this undoing of infrastructures of everyday life, and the state is not just the regime. The state is its institutions, its doctors, its engineers, its teachers, its spaces. So the idea that the state and the population are really very much entangled with each other. We cannot really separate the population health or life or experience from the kind of the experience of what the state is and how the state functions. So for me, this is one of the central ways that I try to look at, basically, and documenting what is happening under these. Like, how can we explore and articulate these unmakings as a form of life? How can we explore everyday life under these kind of conditions? So this is one aspect. The second aspect here for me is to document, is the documentation of these experiences. When I was interviewing a lot of doctors, they were ashamed that they were working under the sanctions. They were ashamed that they were working under places that had lack of technology. They were always comparing, let's say, oh, I'm in Britain, all the things are available, here nothing is available. So they look down at that experience. what I think is very critical for us as social scientists, specifically as people who do history of medicine, history of science, is to actually begin to document the improvised, the kind of practices emerging in these settings, because they also comment on ways of understanding medicine as such, as a kind of a broader field that is practiced in very different ways, you know. So the way we think about medicine as a universal thing is not really true. Is not really true, because medicine is a kind of locally experienced, and the way we see how doctors and educators are responding to this is very much worth of documenting, because it kind of gives us also very deeper insight onto this kind of connection between medicine and society, and the understanding of medicine as a situated field, not just as a kind of a universal thing that is, you know, either it's lacking or it's present, but as something that is responding constantly to empirical crises and issues that are happening in the everyday.
Shall I go next? Before I say anything, I want to say I'm so grateful again to have Omar in this conversation. I mean, over the years, I've learned so much from him, and his friendship is extremely valuable to me. But today, the conversation, this comparative angle is extremely helpful. And I think, Nargis, back to your question about the comparative angle, basically, I think what is important is to be very clear about points of convergence and divergence, because medicine has a local life in different settings. It is a global phenomenon, but it has its own global local life. And so, for example, the discourse of state failure that is perpetuated in this sense, it's important to also remember that different states, and I use the term states in the way that Omar explained, are different in their strategic use of these situations. For example, the discourse of failure can be produced and reproduced by sanctions. You're absolutely right, but sanctions can also be used to mask states of failure that are caused by other things. And I think that's extremely important, because in a lot of bipolar discussions, especially with Iran, this can get lost. This nuance can get lost. And that we appreciate, as in going back to the information and knowledge coming from the lived experience of people who are practicing in that context every day and over time. That's extremely important. And the second point I wanted to make was, hello. The second point I wanted to make was in some, which we didn't discuss, is this question of sanctions is also an extremely sensitive representational issue. I'm glad you raised the question of shame, Omar, because sometimes that's the reaction, but sometimes the reaction is the opposite, because a lot of times, as a result of these restrictions and state of lack or whatever, there are emerging not only practices but also performativities, ways of claims. So a lot of techno-scientific claims, for example, come out of Iran that then don't really deliver. A lot of great science come out of Iran, of course, but sometimes we see a lot of rhetoric also coming not from science really, but from the establishment. And so we have to be very careful about this representational aspect and the psychology of how people perceive themselves under regimes of sanction and on the global stage. And in the report, we've touched on this issue of ability and international relations. The sense of isolation is not just about isolation, it's also about how one is represented on the global scientific stage. So I think I'll finish with that. And thank you, Omar, for your comments.
Yeah, and I'll go last. As a non-medical expert, it was such an honor and pleasure to work with Orkideh on this, and it's been such an honor to be on a panel with you, Omar. As I said, coming from the non-technical background, my interest in approaching the question is to basically appreciate the complexity and echo the point. When we're defining intervention, what we mean by intervention is a response to quote unquote crisis, a crisis that's unfolding, an intervention that's done on the part of the state, in this context, the US. So I think going back to the question of why are we even interested in this? What are we trying to do? It always comes down to we need to respond to something. We need to respond in an episode of a lived experience or a story at this moment, simply because it's in our face, and once it disappears, we can pretend it doesn't exist until it comes back again. As there's a very good example, it's only in our face when it's being bombed. And the reality of lived experience of people in Gaza doesn't go away. Same story with the Middle East. So I think we need to take a step back when we're talking about the state and the intervention the states are taking. Is that why are you even interested in this story? What is the reason you are looking at this? And I think pushing back on this notion of need to act, and the fact that there is an act that can fix this, that there's a fix. We just need to tighten the language. We just need to make the bill more accurate. We just need to do our impact study and reflect it accurately, and then the problem is fixed. I think we need to take a step back to even define what we consider a problem, define what we consider intervention, and basically the motive of even being interested in the lived experience of people in this area, the geographical area that we're talking about. But again, I think we can talk about this for hours, but it's been such a rewarding experience for me to talk about this ongoing research with Omar, Orkideh, and you, Nargis John. Thank you so much.
It's been really a pleasure, and thank you. Thank you, Nargis, and thank you, Sais, and the entire Rethinking Iran initiative for this opportunity. And thank you, Omar, for your wonderful comments, and very helpful, food for thought. We have to go back and think a lot about them now. And I want to thank Tara, it's been a delight to work with her.
Thank you all so much, really, for this conversation. Sorry to keep everyone 10 minutes over, but I think it was worth it to hear those last remarks from everyone on here. So as my daughter's reminding me, it's time to go, but just a quick note that next Wednesday, we have our last event in our Sanctions series, which will be on politics and arts in Iran. It'll be next Wednesday at the same time as this, 12 to 1 p.m. Eastern time. We hope to see you there. Thanks so much again to Omar, Orkideh, and Tara for this wonderful session. Thank you all.
Thank you.